right, so we have a case where there's a lot of pressure in the lower back around L5, and the patient has already sought care elsewhere for the past year and a half, where the patient was given foot inserts to balance the hips, as well as changing the patient's pillows, but the pain continues to be there. Pain is localized at L5, and we can see the IVF is pretty closed up around L5 and L4. The scope picked up a lot more pressure at L5, so we're going to start with that adjustment on the Gonstead knee chest pillow. Right over here. So here you're going to kneel down, knees go here, and your face goes in here. Got it. And let's bring this knee slightly forward. There we go, just like that. And we're going to allow the abdomen to drop. So go ahead and drop the belly down as far as it goes. The patient has never been on a Gonstead knee chest stable, so we are going to instruct them on how this will feel. The adjustment will be pretty deep, and it is a little painful when we set it. However, when you are relaxed, the pain is much less. We do want to get a good set. It will be right here at L5. So I always tell the patient to accept the pain. It's going to be a little tough, but remember that thing's been stuck for a long time. It is going to need some force to move it. We're going to be at L5 right here. I have a pretty good grip. Let's test it. Feels good. Right over here, I'm going to have you exhale and hold your breath out. Keep it there. And we got a big movement. Yeah. And I'm going to let go slowly, and you can come back up.
Wow. That was great.
You okay?
Oh, that was good.
That was different, right?
That was nice.
You know, it was like an explosion inside you.
I even broke a sweat.
Yeah. So that pressure is great. You're going to leave that alone. And I instructed the patient to have that posture where the low back is supported. You want to have that ear over the shoulder, over the hips position. I also want to adjust the base of his neck. He's got a ton of pressure around C7. Head's gone forward. You want to create the curvature in the neck, the upper back and the lower back, because if the curves are off, then it will affect our nervous system, and then of course pain. Let's have the patient lean the head left, right. Right here we feel some resistance, not very comfortable. Right around here we have C7, so we're going to set C7. Hopefully that will allow his neck to come back. Right there. The set is straight across. There's no twisting, zero risk, and no pain. Good. That was a good movement.
Yeah.
All right, and let me make sure that pressure is gone. All right, there's still some pressure there. I'm going to go a little deeper. I always try to check right after the adjustment. Same level. Let's push that 7 a little bit more forward. Allow the shoulder to be relaxed. The set is straight across with no movement. No jerking, I mean. It was perfect. So, you know when the, and that pressure is clear. You know, when we twist the neck, which is probably what you're used to, laying down and twisting it this way and that way, we're making a lot of noise. Okay, it makes noise within the facet joints, but what we want to accomplish is we want to move the bone with the disc. So the movement needs to be forward, not this way. Make sense?
Yep.
So, all right, let's do another one. We'll set the upper back. He's got pressure on T3. I'm sure he feels it right around here. So that one will be done on the high-low. So if you don't mind standing on this black piece and faces down. And I'm just going to bring that up slightly. Perfect. Hands are in front of you. Going down slowly. And we're going to be adjusting T3. Let's bring the head up a little bit to open that area. And let's pump that, loosen that up. All right, let's breathe in and just hold it out for me this time. Got it. Good. All right, more flexible. Good. Let's come up. How was that one?
That was great.
Very deep. All right. So just be mindful of your posture. Head is slightly elevated because your head's gone forward. I promise, within the first few visits, you know, you're not going to feel that anymore. But you just have to work on it. We did instruct you to use the foam roller to kind of stretch that lower back. And I think hopefully by the end of the week, you'll have no pressure there. Sometimes I'll do one adjustment.
Okay.
And the patient comes back, like, I don't feel it anymore.
Yeah.
But usually it might take, 2 or 3
Okay.
for the pressure to come off. Do you have any questions?
No, doctor, I appreciate that. Thank you.
All right.
I feel a lot better.
All right.
I appreciate
Awesome.
your time. Thank you.
You got it. Thank you.